I want to talk about high blood pressure. High blood pressure has been around a long time, and of course it's spiraling out of control. Cover article, Time magazine, it was 2004, and it's still going out of control. It's a simple mineral deficiency in most cases. Sometimes PAD, peripheral artery disease, is involved. Of course, peripheral artery disease, when it occurs in the kidneys, you get kidney failure because the dirty blood can't be brought to the filtering unit, so the kidney stops working because it's just not getting the dirty blood. And, of course, doctors want to put you on dialysis. They want to do kidney transplants when all you have to do is clean up that little artery, get the dirty blood flowing into the filtering units again, and the kidney works again. Well, high blood pressure, again, whether it's due to the mineral deficiencies or the PAD, peripheral artery disease, can cause glaucoma, high blood pressure. Of course, it can be the secondary result of kidney disease because when these little arteries are blocked, the filtering units called glomeruli are not receiving the dirty blood. They release a hormone called renin, R-E-N-I-N, which drives the blood pressure up to try and get more blood through that kidney. And so there's two things you have to do to establish normal blood pressure again. Salt has nothing to do with high blood pressure. I'm going to repeat that. Salt intake has nothing to do with the high blood pressure. Salt is an essential nutrient. You need it for many things. And all kinds of new information is coming out more recently, mostly from European doctors and Canadian doctors saying, you know, the more we look at this, the more people run restricted salt diets, the more diseases they get. Well, that's because salt is required, particularly the sodium chloride part. The chloride part of the salt is required as a raw material to make stomach acid to digest proteins. And so over the last 50 years, gluten intolerance, celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, diverticulitis, and Crohn's disease have gone up 400% because you can't digest these proteins from grains without stomach acid. Pepsin won't work without stomach acid. Your stomach environment has to be very, very sterile, very acid to pull that off. And then, of course, you get reflux when your stomach acid level is more towards neutral instead of like battery acid, because bugs will not grow in your stomach when your stomach acid is down to the level of battery acid. When it starts pushing towards neutral, suddenly now yeast and bacteria can grow, and every time you take in sugar, fiber, or carbohydrates, you get reflux. And doctors make you call it acid reflux. It really should be called lactic acid reflux. So at any rate, the first thing a good farmer puts out for his livestock is a salt block. And, there's nobody out in the pasture telling a cow she's limited to one lick a day. And so I can't believe that my patients are dumber than the cow. All you have to do is salt your food to taste. You get in the amount of salt you want. And, of course, you're more likely to absorb minerals when your stomach is acid. The more mineral you absorb, the less likely you are to have high blood pressure, because in most cases, other than PAD, other than peripheral artery disease, the most common cause of high blood pressure is mineral deficiency. So here's where the 90 for Life campaign, here's where the 90 essential nutrients, the Mighty 90, the Almighty 90, will do the job. And, of course, if people have coronary artery disease, they have vascular dementia, they have kidney failure, or if you just have high blood pressure and you want to really go after it, you want to support and promote healthy blood flow through blocked arteries, you want to support and promote healthy blood pressure, to that 90 essential nutrients, to the 90 for Life, you want to add what we call ultimate daily tablets. They're designed to do that. They're designed to support and promote healthy blood flow. They're designed to support and promote healthy blood pressure. Now, we do have liquid chocolate and chocolate pieces called triple truffle chocolate and triple treat chocolate, and the liquid chocolate is called Cocogivity Plus. And these chocolates actually have flavonols in them, a natural substance, one of the many, maybe 100 different natural substances found in chocolate. And the flavonols actually lower blood pressure. This was published in the Journal of the American Medical Association, August of 2003. And there's no doubt about it. Now, certainly the flavonols in chocolate will not solve the mineral deficiencies that are the basic root cause of high blood pressure. However, the flavonols in dark chocolate will lower blood pressure, much like chocolate is an herb. It's a plant medicine. So it will lower your blood pressure in much the same manner that chemical blood pressure control drugs will do, but no negative side effects. So I take in probably six of those triple truffle chocolates a day, 2 at breakfast, 2 at lunch, 2 at dinner. I use the Cocogivity Plus, the liquid chocolate, in my coffee, so I'm making my own mocha cafe. And so I'm getting my blood pressure down to where it's, 121/71. I take the Ultimate Daily tablets. I take 3 of those twice a day. I've never had high blood pressure problems, but I take it to prevent high blood pressure problems, right? And, of course, every time I go through another little town, I'll run into some pharmacy that has these little chairs. You put your arm in there, push the button, and I get my blood pressure and my pulse. My blood pressure on the average runs 121/71, sometimes down to 112/68. But usually it's like 171/21. My resting pulse is 43. I do admit when I get angry and upset, it'll spike up to 45. When I wrestled for the University of Missouri, my resting pulse was 38. Medical doctors have no earthly idea what a normal pulse is. They would probably take me in and insist that I have a pacemaker put in and put me on the heart transplant list. Well, I'll outlive them. I already have. Their average lifespan is 56, according to their own study. So I want you to get a hold of the book, Dead Doctors Don't Lie. The original Dead Doctors Don't Lie. Get a hold of the CD, Dead Doctors Don't Lie, and you'll get the picture. Oh, yeah, if you want to know the newest information, on top of the original stuff, which is still true, get a hold of the book, Immortality, and the CD called From Here to Immortality. Well, we'll be back with more truth, justice, and the FDI Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, let's see, what pearls of wisdom do you have for us here today?
Well, this is one of those ones that I think kind of vindicates you. Because this is something that you and I have been talking about for quite some time, and it is the FDA and their role in protecting the public from harm, so to speak, whether it be from from bad drugs or whatever. Have an ABC News story here headlined, "The Hidden Outbreak. Why Restaurants Stay Anonymous." They say a certain fast food chain was linked to an outbreak of salmonella. At least 20 people went to the ER, and food safety officials decided, we don't need to tell consumers what happened or what restaurant chain it was or which ones were involved. And they say dozens of cases of outbreaks over the past years. The FDA and the CDC kept the names of these restaurants secret for fear of damaging their relationship with the companies. So once again, and if you're one of these people out there that thinks that this government healthcare thing is such a great and grand and glorious thing, this right here is a great example of government agencies or government bureaucracies that are in charge of some aspect of your health and how they're treating you. They say consumers, these companies actually are voluntarily inform the CDC and the FDA when they have one of these outbreaks. And according to the FDA spokesperson, they say, quote, companies voluntarily share information with the CDC and FDA, so when we publish company or brand names and there is not a public health need to do, it could have the effect of discouraging such cooperation between our agencies and the food industry. And, of course, the FDA spokesperson is not named here. And they go on to say that it's a long-standing policy at both federal agencies, as long as it does not pose an ongoing public health risk. The companies and the source of the outbreaks are kept out of the headlines. However, some policy critics say that is dangerous in itself. A guy from there's a food safety newsletter that comes out, and Bill Marler, he's a attorney and contributor to that publication, says, I have the right to know that because I might want to shop there. I may not want to take my kids there. And they also get an opinion from a woman by the name of Barbara Pruitt, who almost died from a case of salmonella a few years ago. She says, I don't think I should be jeopardized because someone can't let me know about information that is readily available. And, of course, they all claim it's to here's the best one, though. There's a former FDA Associate Commissioner, David Acheson, and they say policy is in place because it's not the food safety officials' mission to name and shame the restaurants, but just to protect the public health. Well, if you're not informing people about things they need to know about, I think that's not doing your job. And this Food Safety News actually revealed that this mysterious Mexican-style restaurant chain that was linked to an outbreak of salmonella last year was only referred to in the federal documents as Restaurant Chain A. And it came to light after Food Safety News did some digging around that it was Taco Bell. And actually, 68 people were infected in 10 states, and their CDC saying that, the food was contaminated before it got to the restaurant. Well, that means it's in the food processing plant, and it could happen again. And why wasn't the public informed? It's just insane.
Yeah, well, this is the same sort of attitude that the FDA has about nutrients, and this is why I sued them 8 times in federal court and won. Even the federal court recognized how egregious the FDA's behavior was. And so, we couldn't say by supplementing with these nutrients you can reduce certain diseases. You can only say eating foods rich in these things. Well, how do you know by looking at the food if it's rich in these supplements or not, or these nutrients or not? You can't. The only way we can guarantee you're going to have the nutrients to prevent the disease or solve the disease or fix the disease is the supplement. I had to sue in federal court to be able to say that. Well, here's the FDA. Well, we'll be back after these messages. Well, let's see here. Doug, let's go to callers.
Let's head to Chicago, Illinois. And Cindy, you're on with Dr. Wallach.
Hello, Cindy, you're on the air.
Hi, Dr. Wallach.
Hi, how can I help you?
I have a friend that is 80 years old, and she weighs about 180 pounds. She's dealing
I'm sorry, was
with
that 108 or 180?
180.
180.
Mm-hmm.
180?
180.
Okay, got it. Okay, go ahead.
And she's dealing with Crohn's disease, high blood pressure, and diabetes. But she also informed me she has a fatty mass growing on her liver.
Okay, so see here, she got Crohn's disease, diabetes, what else?
Lupus.
Okay, there is something else.
And she has a fatty mass that's growing on her liver.
Mm-hmm. Okay. It's not unusual to have benign fatty tumors called lipomas. I've seen them as big as basketballs sitting on people's livers, okay? So unless they use the word cancer, fatty mass in of itself could be obstructive just by simple sheer mass. But let's go with, how tall is this woman, do you know?
5'7".
5'7"? Okay. So at 5'7", I would say maybe losing 15, 20 pounds over maybe a 3 to 6 month period would be good. Diabetes is easily dealt with. Crohn's disease, this lady has what's called gluten intolerance. She must get on a gluten-free diet immediately. All her other problems have come from this. And her children, if this lady has children, all her children have gluten intolerance, so they must go on the same diet. Absolutely no wheat, barley, rye, or oats, no cereals, no pasta, no Timmy Hortons, absolutely no Pop-Tarts, Pillsbury toasters, strudels, no pancakes, no waffles, no spaghetti. You got to watch all the processed meats with nitrates and nitrites in them. They use wheat as a filler. They use wheat as a thickener for tomato soup, gravy. They put breadcrumbs and meatloaf. I mean, wheat, barley, rye, and oats is everywhere. Got to read labels very, very discriminatingly. And this will add 25 years to everybody's life if this lady and her children give up wheat, barley, rye, and oats. Now, the diabetes is a secret sauce, which I'll give you here in a second. So it goes by body weight. And I'd have her take 2 of those Healthy Start packs a month. That will allow her to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 Healthy Start packs per month. That's going to give her all the 90 essential nutrients. And then specifically to support and promote healthy carbohydrate, fat, and sugar metabolism at the cellular level, and to support and promote a healthy blood sugar level, I would have her take a minimum of 6 of the Sweeties per day. 3 at breakfast, 3 at dinner. That would be 2 bottles a month of the Sweeties. And I would have her be sure to test her fasting blood sugar every morning before she medicates herself. We don't want to be in a position where she's just taking medication because she always took amount X. Just do that because her blood sugar is going to drop very quickly. But hang on, because we have to deal with a little more. So hang on, we'll come back and we'll deal with the lupus and any blood pressure problems, anything else in this fatty mass after these messages. Okay, Doug, we're going right back to Illinois and Cindy. Now, let's see. Here we left off with the 2 Healthy Start packs. We left off with the Sweeties, 3 twice a day for the diabetes. Now, I do want you to appreciate that this friend is going to have to monitor her blood sugar every morning, because as her blood sugar drops, and it will drop, I don't care what it is now, it's going to drop. And so she has to take less medication, just as she's been instructed to do. As her blood sugar drops, she'll need less and less medications. If it goes up for some reason, she needs more medication. But the goal is to get her down below, say, 80 every day without medication, then she can wean off her medication. But when does she stick on the program? Well, forever, as long as she needs oxygen and water. Now, for the high blood pressure, I would also have her take the Ultimate Daily tablets, 3 twice a day, 3 at breakfast, 3 at dinner. That'll require 1 bottle a month, the Ultimate Daily tablets. And then for the lupus, she's going to need to take the glucogel, 2 things, glucogel, which is the raw material to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. At her body weight with lupus, I'd have her be a little heavy-handed. I'd have her use 15 glucogel capsules per day. I don't have lupus, and I take 10 a day, 5 at breakfast, 5 at dinner. So she needs 15 a day until she achieves the level of pain relief and swelling relief and restriction relief that she needs. She could cut it down to 10 a day for maintenance, 5 at breakfast, 5 at dinner. But to begin with, I'd have her take 15 of these glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. That'll require 2 of the large 240-count bottles per month. And for both the lupus and the Crohn's disease and the fatty mass in her liver, I would have her take 9 selenium a day, 9 of our selenium a day. That's 3 bottles a month, 3 at breakfast, 3 at lunch, 3 at dinner. And that's going to support and promote her immune system. That's going to reduce inflammation. It's going to support, and I've been able to, I sued the FDA successfully in federal court to be able to say this, that selenium supplementation will support the body's ability to manufacture and make anti-cancer, anti-mass substances, okay, like glutathione. You can actually recycle glutathione many, many times in the presence of selenium. Without selenium, you can't manufacture it, and you can't recycle it. So glutathione, one of the best defensive mechanisms the body makes, requires an enormous amount of selenium every day. So 9 a day, 3 at breakfast, 3 at lunch, 3 at dinner. And also, if there is a mass that's being caused by free radical damage and so on, you know, like the fried foods and processed meats with nitrates and all the alls that this lady's supposed to avoid. I mean, totally, 0, 0, 0. And then I want you to call me every 2 weeks, if you would, please, Cindy, and let me know exactly what she weighs. I want to know her blood sugar levels. I want to know her A1C hemoglobin. I want to know her blood pressure, her pulse, and I want to know her pain level and all that kind of stuff. But don't forget, absolutely no gluten, no wheat, barley, rye, oats. That's a basic thing for all this, and then none of the other bad stuff. No sugar also, because she's diabetic. No sugar, natural process. She could use things like stevia and Splenda, sucralose. Those things are all acceptable. They are all natural substances, and they do not cause any problems. So, with that, let's see here. Doug, how much time do I have before we go to another caller?
Less than 30 seconds.
Less than 30 seconds. I figure we're kind of close here, so I'm going to go ahead and just remind you, contact your FDI Youngevity associate and ask them how to become one of our associates. And not only will you be able to buy all our products at 30% off, but you'll be able to get a check from us every month, too. They'll teach you how. Okay, Doug, let's go to callers.
Let's head to Baltimore, Maryland, and Frederick, you're on with Dr. Wallach.
Hello, Frederick, we're on the air.
Hi, Dr. Wallace. How are you?
Okay, sir. How can I help you?
Well, I got a GI bleed. I'm anemic, and also I'm asthmatic.
Okay.
What can you help me on?
Okay, well, let's see. How long have you been bleeding from the GI tract?
About a couple years now.
Okay. Now, do you have a history of irritable bowel syndrome or ulcerative colitis, anything like that?
No.
Constipation or diarrhea?
Constipation, sometimes diarrhea.
Okay, so it alternates a little bit. Okay. What about skin problems? Anything going on with your skin? Eczema, dermatitis, psoriasis?
No.
Okay. How long have you had asthma? Has this been since you were a kid?
About 10 years now.
Okay. All right.
I also smoke. So.
I'm sorry, say again?
I also smoke.
Okay. Well, we can help you with that, too, if you wish. Now, what do you weigh?
218.
All right. How tall are you, sir?
6'4".
Okay. All right. Well, whenever you have asthma and gastrointestinal problems, with somebody who has gastrointestinal bleeding and alternating constipation and diarrhea, excuse me, I would probably make a preliminary diagnosis of gluten intolerance, okay, and call it ulcerative colitis, irritable bowel syndrome, inflammatory bowel disease. And bleeding can come from something as simple as hemorrhoids, or it could come from, again, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, ulcers, could be something more serious. So I'm assuming somebody's looked at this. Have the doctors said anything where that blood is coming from?
Well, they can't find where it's coming from.
Okay.
I know it's coming out of my butt, but they don't know where.
Okay, well, that could be a good thing, okay? So they don't have a big ulcerative cancer or something someplace. They can't find anything like that, so that's a good thing. So here we go. Number one, you need to get rid of all the bad stuff in your life. No fried foods whatsoever. I mean, nothing fried, no exceptions. You got to get rid of all this inflammation stuff going on in your whole body, let alone your testes. Do you have anything like high blood pressure, diabetes?
No.
Okay, good. All right, so no fried foods. No processed meats with nitrates and nitrites. I mean, nothing like deli slices, sandwich meats. No sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, corned beef, Spam. If you're going to eat canned fish, it's fine, but they got to be canned in water. They cannot be canned in oils or packed in oils. And then no carbonated drinks with meals. An hour before meals, during meals, an hour after the meals. So effectively, 9 hours a day you're going to be without carbonated drinks. Then 218 pounds, I'd have you take 2 of those Healthy Start packs per month. Don't forget, you're going to be on a gluten-free diet. No wheat, barley, rye, or oats. No wheat, barley, rye, oats in any form. We actually have a CD called Cereal Killers, Cerial. It's kind of a combination of serial killers, like people who kill a lot of people, and cereal that you eat. So Cerial, Cereal Killers. Get a hold of that CD and you'll understand what's going on here. Your doctors have missed it badly, okay? And so I'd have you take 2 of those Healthy Start packs per month, 1 full dose of each of the 3 products of breakfast and dinner. That's 1 ounce of the OsteoFX Plus of breakfast and dinner, 2 scoops of the Ontane Tangerine NutriCrystals of breakfast and dinner, 3 of the EFA Pluses of breakfast and dinner. All that will be accomplished by the 2 Healthy Start packs per month. I would also have you take the de-stress capsules. I'd have you take something like, since you're anemic, I'd have you take 9 of those a day. I'd take 6 a day, 3 at breakfast, 3 at lunch, 3 at dinner. That'll be 3 bottles a month of the de-stress capsules, capital D like David, dash the word stress. I would also, let's see here, I think that's where I would go. Let's see. Okay, yeah, that's where I would go. I would also take some anti-inflammatory stuff. The anti-inflammatory stuff could be something as simple as the CM Plus cream, CM Plus capsules, CM Plus capsules. You can take 2 or 3 of those 3 times a day. It'd be 3 bottles a month. And they reduce the general inflammation level of your body because it's going to take a couple of weeks, couple of months to resolve the damage that's occurred in your intestinal tract, and it'll speed up, reduce the inflammation by taking that CM Plus capsule 3 times a day. It's 3 bottles a month. But it's imperative to stay away from the gluten, no wheat, barley, rye, or oats, no fried foods, no processed meats, no oils. That means no margarines, no mayonnaise, no salad dressings, no cooking oils, no meat or fish or chicken or anything packed in oils. Okay, call me every 2 weeks if you would, please. I want to know all your numbers, your blood pressure, your weight. I want to know if you're still passing blood through the bowel movements, and then let me know what's happening with the diarrhea and the constipation. Okay, Doug, let's go to callers.
Let's head to Kansas. And Sarah, you're on with Dr. Wallach.
Hello, Sarah, you're on the air.
Hey, so my mom bought this Beyond Tangy Tangerine, and she's really impressed with the results she's been getting from it. And we were wondering if me and my 2-year-old daughter would be able to take that product. She also got some One World Whey. And the thing with me is I'm 5 months pregnant, and my daughter's 2, and we were wondering if, that's something we could be taking.
Well, how much do you weigh?
About 130 pounds or so.
Okay. And you're 3 months pregnant?
I'm 5.
5, okay. Okay, well, the baby is formed by the end of 3 months, so you got what you got, right? This will certainly not cause any problems. and 130 pounds. Are you planning on breastfeeding this baby?
Yeah.
Okay, so what I would do is get one Healthy Start pack per month for yourself, and that would allow you to have a tablespoon, which is a half ounce of the OsteoFX Plus at breakfast and dinner. I want you to take 1 scoop of the Beyond Tangerine NutriCrystals at breakfast and dinner. There'll be 3 EFAs per day, so you can have one at breakfast, one at lunch, one at dinner. All that will be accomplished with the one Healthy Start pack per month. But because you're planning on breastfeeding this baby, I would take an ounce, so you're going to have to get another quart of the OsteoFX Plus, get another quart of the OsteoFX Plus. I would take an ounce of this out of this extra quart, OsteoFX Plus, at bedtime with a glass of water. That's going to help you sleep better, and that's going to provide the extra minerals you need to properly breastfeed the baby. And it's best if you stay away from all the bad stuff, fried foods, et cetera, et cetera. Now, I'm assuming you don't have any asthma or skin problems or anything like that because you didn't say anything about that, right?
Right.
Okay, so it'll be actually better for the baby if you stay away from fried foods and processed meats with nitrates and nitrites and oils and all that bad stuff, okay? Now, this 2 or 3-year-old you have, how much does she or he weigh?
About 30 pounds.
Okay, and what's the baby's name?
Lila.
Lila, so it must be a lady. Okay, well, hang on, I'll come back and I will let you know what you can do for Lila after these messages. We're back with Dead Doctors Don't Lie, the ZBS Radio Network. Dr. Joel Wallach here for FDI Youngevity and the 90 for Life Crusade. And Doug, we're going right back to Kansas and Sarah. For a 30-pound Lila, I would give her a teaspoon and a half twice a day, once at breakfast, once at dinner, teaspoon and a half each time of each of the liquids. And, of course, the EFA pluses, I'd give her 2 a day because she needs EFAs, right? So they're essential nutrients. So I would puncture the EFA pluses at 3 years old and put them in applesauce or something like that. She'll take down, so she's going to have the contents of those capsules twice a day. And then congratulations on the pregnancy, and congratulations, your mom's doing well, and she's making sure you're going to do well, and your babies are going to all do well. Okay, Doug, let's go to callers.
Let's head to Arkansas. And Greg, you're on with Dr. Wallach.
Hello, Greg, you're on the air.
Yes, sir. Is there anything that need to be done to stop ringing in the ears?
I'm sorry, say again?
Is there anything that can be done to stop ringing in the ears?
Oh, yes, sir. Ringing in the ears is called tinnitus, and this is caused by osteoporosis of the skull. Is this for yourself, Greg, or somebody else?
For me, sir.
Okay, how much do you weigh?
About 170.
Okay. This goes by body weight. You don't have anything else, any high blood pressure, or diabetes, or arthritis?
No, sir.
Okay. How old are you, sir?
53.
All right. All right. Well, what I would do is have you get away from all the bad stuff. You know, stay away from the fried foods and the processed meats with nitrates, nitrites. Stay away from the oils, all kinds. Stay away from the carbonated drinks with meals. And the supplement program would go like this, because, again, this is caused by osteoporosis of the skull, squeezing the auditory branch of the 8th cranial nerve. Number 1, for temporary relief, you can take our CM cream, that's C for cat, M for Mary, CM cream. Take a half a teaspoon 3 or 4 times a day with a Q-tip, put it down in your ear like you're trying to get wax out, and oftentimes, 80% of the time or so, you can get relief within 10 to 15 minutes, and relief will last 3, 4, 5 hours. And of course, you have to do that several times a day to keep the ringing down. But to eliminate it, you're going to have to rebuild your bones. So you're going to have to take 2 of those Healthy Start packs per month, 1 full dose for the 3 products at breakfast, 1 full dose for the 3 products at dinner time. I would also take our glucogel. Until the ringing stops, I would take 15 glucogel a day, 5 at breakfast, lunch, and dinner. That's 2 of the large 240-count bottles per month. I would also take the de-stress capsules, 3 of those twice a day, 2 bottles a month. And then give me a call every 2 weeks. I want to know a progress report, either lack of progress or progress report. Things are going well, things are the same, things are getting worse. But let me know and let me talk to you every 2 weeks. You're welcome to call more frequently if you need to. But don't wait longer than 2 weeks. We'll be able to walk you through this because this is an easy one to deal with. Of course, you go to a EENT, ear, nose, and throat guy. He is going to want to do surgery, put implants in your ears, and all this kind of stuff. I would say a big shout, no, no, no to that one, because this is something you can resolve yourself, and we'll go from there. Okay, now we only have a few minutes left, and so I'm going to go ahead and take it and remind people that if you're going to do the FDI Longevity business as a business, I want you to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy. All that's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. If you're going to do the FDI Longevity business legitimately as a business, this is legitimately tax deductible because this will be a reference file for your office. And, of course, the idea is for you to become a member, an associate. You'll be able to get the products for wholesale. You can earn checks and create cash flow. Your FDI Longevity business will become a willable asset. You'll get legitimate tax deductions. If you're working, you'll be able to get back a significant amount of your withholdings, which you cannot do as a good employee. And so these are all things you need to do. And if you're going to do this, you want to get your family involved, your kids, grandkids, nieces, and nephews. Get a hold of that book, Wall Street for Kids. Wall Street for Kids. There's probably something in there. If you've been an employee all your life, there may be something in there you need to learn, too. It teaches you how to build and operate and grow a profitable business, how to maximize legally your tax deductions. It's called Wall Street for Kids. Contact your FDI Longevity associate and say, I need to be an FDI Longevity associate. I need the book Wall Street for Kids. I need the trilogy book, and I understand if I run the business, they are, in fact, tax deductible. Well, thank you, everybody. Really great testimonies and questions today. And thank you so much, Doug and Easton. Superlative job as usual. God bless each and every one of you. God bless our troops. And God bless America.